Today we are going to talk about an issue that affects many women, yet they often ignore problems because they assume they can't be helped, or they're simply too embarrassed to mention it even to their doctors. It's called Pelvic Health, and now there's a new program in the South Bay dedicated exclusively to this key health issue for women. Nearly 1/4 of all women in the US are affected with one or more pelvic health disorders, and then the number dramatically increases as women age. Let's go to El Camino Hospital and talk to Dr. Levine. So we're here at El Camino Hospital with Dr. Levine. Dr. Levine, thank you so much for joining us today.
Thank you for having me today.
So tell me, 24% women suffer from pelvic health issues, yet there's a lot of stigma attached to it. Women don't openly discuss about their problems. What do you see in your practice? What are some of the disorders?
Well, I see all ranges of women's issues, but mostly we talk about incontinence, we talk about pelvic pain, we talk about the loss of support of the pelvic muscles to allow organs to come out of their original position called prolapse. Those are the main. It extends into sexual dysfunction, complaints of pain and being uncomfortable during those types of activities, and those are the things we try to focus and improve.
Well, some of the symptoms are so common. Everybody suffers. A little bit leak over time, over age, and some of the other things you mentioned. Women may not think of getting themselves checked for these issues. What would you advise our viewers? What are the small things they should be looking for so that it doesn't become a big issue later?
Well, we don't think, in my practice, I'm a urologist, I don't think anyone should leak urine involuntarily. That's not a normal part of aging. It just happens to be one of the things we see with aging. So much like anything else we try to improve upon and protect ourselves from, that too is something that I think, if we're lucky and you try hard and you exercise and do things to specifically strengthen the pelvic floor, you might not experience incontinence. But if you've had many children and those muscles have been stretched out beyond what exercise can recover, you still may. So if you have anything that makes you adjust your behavior to adapt to, then perhaps it's time to talk to your doctor.
This seems very complicated, but I believe there are some simple steps, some simple exercises that we can do to prevent all of this.
Well, we hope so. We certainly, with good pelvic support, you have a better chance of preventing it. Some women are destined by genetics or behavior or numbers of pregnancies and just bad luck. They're destined to develop things beyond their own control.
Right.
So exercise isn't, that's right.
Right? How effective is the surgery?
Well, surgery is very effective. The incontinence surgery is more effective because it's a less invasive and less dysfunctional anatomic issue. So we do sling surgery, we do injection treatments, there are different things we can do to make it so that you don't leak urine when you cough, sneeze, or exercise. Prolapse surgery is more complex. You have to recreate an organ system that's become distorted and abnormal. And so that surgery is more intrusive and bigger scale. That's why El Camino has been so forward thinking. We have robots to make it less invasive. We have specialty trained surgeons to make it most effective and most successful. And we have better education and better pelvic health programs now to try to help women who don't need surgery yet never need surgery.
Right. El Camino Hospital is so dedicated to women's health. I already feel so special coming here. That you focus on women's health. What are some of the programs that you have that could help us prevent?
Well, just by the fact that El Camino Hospital dedicated itself and created a women's hospital at El Camino, which is extraordinary, and I feel very proud to be part of it. They recognize the different needs and special needs that women have in healthcare in general. So we have programs focusing on breast health and cardiac health. And now we have a pelvic health program. We have total control. We were working on expanding exercise programs and accessibility to our community with other educational programs so that women can understand that the pelvis is something they can talk about with their doctors, that pain is not acceptable. Dysfunction is often treatable and usually without too much intrusion. Right. Surgery is not the worst thing in the world. I'm a surgeon. People do great. They tolerate it well. They recover quickly. But we are very proud here and good about identifying who really needs surgery, who can benefit from things before they need surgery, and how to prevent anyone from needing surgery if we could. The advantage of our program, because El Camino understands that being accessible to the community is so much more important than the nuance of reimbursement, we have classes with nominal fees just to make people committed to attending, that anyone in the community can attend. So they can start their learning, whether they can come to me or any of my colleagues becomes a little more selective, but at least they get a foundation and maybe delay the need for any further intervention.
And if they like, they can always move. I can't wait to move to this beautiful, gorgeous hospital just to be here.
Well, we'd be thrilled to have you, so thank you
so much. And like they say, stitch in time saves 9. Let's learn some of the exercises that Meenal Majumdar is going to show us now. So Meenal is now going to show us some of the exercises, the basic ones that can prevent
pelvic floor dysfunction.
Yes.
First, I'm going to teach you this lower abdominal strengthening exercise. This is a basic stabilization exercise for your lower abdomen. First, start with breathe in. While breathing out, take your lower abdomen in. It has to be a very subtle contraction of your lower abdomen. Make sure you're not using your upper abdominal muscles or tilting your pelvis. It is just muscular contraction. You can hold this contraction for 10 seconds and repeat this exercise 10 times. It is recommended to do this exercise at least twice a day. Each time should be 10 times. Next exercise is going to be pelvic floor strengthening exercise. I always tell my patients to imagine as if they are going up the elevator. So imagine your perineum is elevator. So I'm going to instruct you, lift and squeeze your pelvic floor. And imagine as if you're going up the elevator. So lift and squeeze more to go onto first floor. Lift and squeeze more to go on to second floor. When you achieve the maximum contraction, hold for 5 seconds. It would be beneficial for you to count loud. 1, 2, 3, 4, 5. And completely relax your pelvic floor. Make sure you give enough time in between 2 repetitions. Repeat this exercise 10 times and do it 2 times a day, each time being 10 times. Next exercise is going to be multifidus strengthening exercise. So this exercise is a back stabilizer exercise. Very, very important for stabilizing your pelvis. So keep your ball underneath your leg. The leg down is going to be bent. Lay on your side. Repeat. Breathe in and breathe out while taking your lower abdomen in. Keep the lower abdomen in and press down on the ball. 1, 2, 3 and release the pressure. 1, 2, 3. You can feel your contraction on the lowermost part of your back. That is your multifidus. So this exercise is a stabilizer exercise. and you can repeat it 10 times on each side, right and left. You can be doing this exercise twice a day, every time 10 times.
One of the things that I want everyone to understand that makes El Camino so special and different is that we actually have incorporated into this women's program physical therapy specializing in the pelvic floor. That's extraordinary. So we have the ability to send our patients who might not yet need surgery, who might have pain, who just don't know what to do. I send 2 or 3 people a day, and now we have me now and the support of the hospital so that they can get the specialized pelvic floor physical therapy that they need that we've just not had the ability to do before. So I think that makes this program even more extraordinary and more special and gives us a better chance to treat all the different things that our patients experience.
Minal, I'm coming to your next class.
Sure. Yeah,
All
you're
right.
most welcome.
Thank you so much.
Thanks a lot.
Thanks for showing us the
Thanks for
exercise
having
and
us.
thanks for giving us all this insight on pelvic health issues.
It's our pleasure.